have another date. Hello. I think some of it might have got cut off. I just want to greet everyone who might be here right now. Thank you for coming. It is another day of the Mobilize Maternal Health Coalition, our advocacy, our organization. Right now, our goal is to have a teach-in. As you may know, we are coalition building. Longtime New York State advocates and organizational partners have been incredibly dedicated to improving outcomes for mothers and infants and promoting comprehensive healthcare solutions. We aim to reduce maternal mortality, infant mortality, and champion legislation for increased access to midwifery and birth centers, and share stories to inspire. And our coalition members, some of the initial ones have been the Birthing Place Foundation, Push for Empowered Pregnancy, New York CPMs, New York State Birth Center Association, A Better Balance, Save a Rose Foundation, and more, and growing, and we'll share at the end. And we hope that people get involved as an organization, as an individual who wants to uplift. If you are here today, we would love to see a greeting in the chat. Please say hello, put your name, put your affiliation, and if there is any intersection that you personally have with birth or some of the organizations here, drop a line. And even if you're catching the playback, please drop a line. We'd love to have that engagement, which I believe helps drive people to know more about what we're doing. So what we are doing today, New York CPM, and that's New York Certified Professional Midwives, an organization that's been doing incredible work. And we're turning a corner, hopefully, to get some important legislation passed. And you'll learn much more about CPMs and the ongoing progress, okay? Followed by that will be A Better Balance. The combination of people who are in that team have done incredible work in advocating for paid maternity leave, additional helpful things that families can know to demystify how to access some of the benefits available to us prenatally, postpartum, even breastfeeding. It's important to just get a good sense of all of that, and really celebrating the victories. And this past yesterday at the maternal in Albany, I was able to hear from Solange and just Michael Solange, and just said incredible things about the work you guys had been doing and continue to do. So thank you for being here to share with the community, the broader community today. And followed by that, I will also give a brief update on how this past day has gone in an examination of maternal mortality and morbidity rates in New York State, a hearing that was held yesterday, State of Maternal Health. And that's going to be the day. So please show some love in the chat as we continue. And now we're going to start with the New York CPMs. And I think they're all piling up in here. Okay, really great. So we'll have about a 35-ish minutes with these lovely CPMs, about 10 minutes with A Better Balance, and about 10 minutes with me. And hopefully we'll also just have time, open space for Q&A to follow. And please drop your questions as we go so that we can kind of flag them and have a really productive Q&A time at the end. Thank you. I'll hand it over.
Thank you so much, Myla. Thank you. So my name is Nubia Earth Martin, and I'm here with 3 other members of NYCPM. And we're going to take this time to kind of just talk to you a little bit about the bill that we're trying to get passed. So it's CPM Bill S5542, A1125, and this is a bill that aims to recognize licensure for the certified professional midwife here in New York. And we're going to take a moment just to introduce ourselves and, in the heart of storytelling, give a little bit of testimonial as to why this bill is important for each of us as individuals, but also why it's important for the families that we serve, or hope to serve here in New York, and for the communities that, would benefit from this type of midwifery care. So as I said, I'm Nubia Earth Martin. I am the president and founder of Birth from the Earth, Inc., which is a community-based nonprofit organization here in Yonkers, New York. And we're dedicated to improving maternal health outcomes and access to midwifery care. And as a lifelong resident of New York and a birth worker serving the community since 2008, I answered the call to midwifery, and initially I chose the two routes, or one of the two routes that is legally recognized currently in New York and available within the state. So I hold a master's degree in midwifery from SUNY Downstate Medical Center, and I soon realized that this route primarily prepares one for providing midwifery care within the medical industrial complex. And as a mother of 5 children who birthed my first 2 in hospital setting and then went on to have 3 amazing home births with midwives, I knew that I wanted to support families in out-of-hospital setting. And as this option is evidence-based proven to be the safest for those who are experiencing healthy and low-risk pregnancies, I ultimately went on to obtain a postgraduate degree in international midwifery, and then went on to complete common sense childbirth midwifery program so that I could become a certified professional midwife. And I'm currently licensed in New York State because I believe that community midwifery care is important and a viable option for those who seek it. So currently, New York is in dire straits regarding maternal health outcomes, access to community-based midwifery. We experience midwifery care deserts and overall midwifery care apartheid. Recognizing and licensing certified professional midwives in the state remedies all of the above issues. Imagine having qualified, skilled, knowledgeable individuals ready, willing, and able to serve families in New York. Yet rather than embracing this as a solution, New York currently criminalizes said midwives. Consider this fact. As we think back to less than 2 years ago, when we were in the midst of the pandemic, our then governor created an executive order welcoming midwives who are licensed in other states, including certified professional midwives, to assist in the midst of a crisis. In regards to maternal mortality and morbidity, we are still in a crisis, with numerous counties and communities not having access to midwifery care, Black women dying 8 to 12 times more than their counterparts. With 85% of pregnancies considered to be healthy and low risk, those families deserve to have a provider that resonates with them. And the lack of trained midwives and out-of-hospital midwifery care should not be the reason why. When these midwives are fighting to get a bill passed so that they can serve families and communities, we need to rally together to support that effort. As someone who experienced and completed both pathways of education, I can unequivocally say that the certified professional midwife route is geared towards preparing midwives for community-based out-of-hospital midwifery care, which is exactly what New York State is currently lacking. So we have side-by-side comparisons of both educational pathways. We have a really innovative and interactive slideshow that we're going to share. And so I'm going to let the other folks introduce themselves so we can get into it and have time for Q&A as well.
Thank you so much, Nubia. Can everybody hear me? Great. Thanks, Nubia. Thank you for that beautiful introduction, not only of the bills, but also of the CPM credential and who we are as certified professional midwives. My name is Tisha. I have been involved in midwifery politics and policies around expanding access to midwifery care for all families in all settings for about 30 years. My sort of entrance into birth work started really 40 years ago after the birth of my first baby. Like Nubia, I also have 5 children, but after the birth of my first baby, which was a home birth, in the Pacific Northwest part of the country. I'm from the East Coast, but I happened to be out there during this first pregnancy in the state of Washington, which has a large midwifery school, Seattle Midwifery School. It trains certified professional midwives as well as other midwives. It's an incredible state for midwifery. I happened to be there, no coincidence, but there I was having my first baby. I had my first baby at home. And as is true for many birthing families and birthing people, I had a very transformative experience experienced during that birth in terms of the power and the agency and the autonomy and the support and the love and the information that I received in home birth care, that I decided to get involved in birth work. The first thing that I did was to become a certified childbirth educator. I've been teaching childbirth classes for about 40 years. And over the course of the following 10 years, I had 4 more children, and I earned a total of 4 credentials around birth. I was a certified and am a certified childbirth educator. I became a certified doula. I had been attending births for probably 15 or 18 years before I decided that I wanted to become a midwife. And when I decided to become a midwife, I knew that the only kind of care that I felt most strongly about, most passionately about, was the certified professional midwife, out of hospital midwife route. So I started the process, which is a very strong apprenticeship process and a very strong didactic and clinical experience process. It took me about 4 years working through didactic programs as well as attending births. I think one of the big differences between the different modalities, as Nubia discussed, she did both. One of them really sort of involves sitting in a classroom, and the other, the CPM credential, involves attending births. I didn't attend a university. I attended births, hundreds and hundreds of them, both as a doula, and then when I started my CPM training, hundreds of births to prepare me for becoming a home birth midwife myself. I also hold the credential of being a certified lactation counselor, and busy with birth work, and very happy to be one of the spokespeople as a NYCPM board member, trying to promote and elevate the CPM credential to our legislators so that midwives are no longer criminalized for attending births, but are rather very much part of the fabric of the maternity care system here in New York, which we know suffers and struggles with several maternity care crises, all of which CPMs are poised to very positively, effectively, competently address. So we'll talk about all that as we click through some slides. I'll pass it over to my friend and colleague, Danielle, who'll talk about her work and her background. And we'll go from there. Thank you.
Thanks, Tisha. Appreciate it. Can everybody hear me okay?
Yes.
I've got a little bit of a cold, so I'm going to try to keep any coughing to a minimum here. Hi, my name is Danielle. I also am a CPM. I'm a licensed massage therapist, breath worker. I was called to midwifery fairly young, like kind of right out of school is when I figured out that that's what I wanted to do, like when I grow up. Went to massage school, moved out west with the intention of actually doing a nurse midwifery program because I knew that, that I didn't actually know much about home birth midwifery. I didn't know much about direct entry midwifery at the time. And I knew that Portland, Oregon at OHSU, they had a great nurse midwifery program out there. So I moved out there, and in the process, discovered Birthing Way, which is a CPM program out there. And I really wanted to feel very confident in natural birth. And talking with friends that I knew who had had home births, I hadn't had any children at that point, people that had, new midwives who had gone through different pathways, they said that, it's hard to hold on to natural birth when you go through a nurse midwifery program, but that you really get that when you go through a CPM program because you're seeing it over and over and over again. And so I went the CPM route, not expecting that I would be coming back to New York State because I knew that in New York, I probably wouldn't be able to practice if I came back. And then here I am. I ended up back in New York because life happens that way. So I am working with these lovely folks to try to get licensure happening in New York State so that I can practice and serve my community here. I'm also on the board of NYCPM.
Great. Thank you, Danielle. How about you, Stephanie? Say a quick hello.
Yeah, hi everyone. I'm Stephanie. I'm a CPM student, so a certified professional midwife student at Common Sense Midwifery. And I'm really honored to be able to just be here to share my story and like the fact that we urgently need the CPM licensure here in New York. I'm a mother of two and expecting my third this spring, and have been fortunate to have these babies at home and know how that has shaped my vision of what autonomous community-based midwifery care really looks like. And I've seen what it feels like to have the trust and support to choose the birth that you want, and the impact that that's had on me and my family. And I hope that we can expand that here in the Bronx, in Washington Heights, where I grew up, so that we can provide safe, culturally aligned, and affirming midwifery care to more people. And being a student midwife, living in a state that does not license midwives, means that I have to leave New York to gain my clinical training. I have to go to New Jersey whenever I'm doing this, and I can't directly serve my community. Which is something that is just extremely heartbreaking, right? I want to be able to serve the people that I grew up with, that I live with in my community. They deserve, right, to have midwives that are trained, that are culturally competent, that are bilingual, that can speak the language, right, that can serve them and provide holistic, physiological, out of hospital, right, specific care. And if this licensure doesn't pass, then at some point I would have to leave. And it's just such a deficit for so many of us that, like Danielle, right, have gone somewhere else in pursuit, right, of being able to actually serve our communities. And so I really hope that we can make some of that change. And specifically for me, I chose the CPM route knowing that there was this limitation because I knew that I wanted to practice in the out of hospital setting, and I wanted an apprenticeship model. I wanted a hands-on, right, model where I could learn from fellow midwives, right, where I could attend births firsthand and be learning and connecting what I'm learning in school directly with the practice, because I think that's going to make me a safer and better provider long-term for my clients. And I hope that this is something that we can really start to understand, ask questions, and figure out why not New York? It's already available in so many places. And so, why can we, if our neighboring state, right, is able to offer this option, why are we not able to offer the same thing to our people? So excited to be here with y'all and share this space with everyone.
Great. So as Nubia said, we have a couple of slides that we're going to click through. And I love this little tagline that we have on our slide presentation: midwifery in the community for the community. That is what certified professional midwives provide that service. We are trained to provide that service, as Stephanie talked about wanting to do that so desperately in her community. So Samantha, I'm not sure if you can hear us, if we can click through the slides, if we can go to the next slide. Nubia, did you want to start?
Sure. Yeah. So this is just going to give a little overview of what a licensed certified professional midwife is, right? So they hold the CPM credential. They're able to educate and offer expert care, education, counseling, and support women during pregnancy, birth, and the postpartum period. It's a fast-growing segment of the midwifery profession in the U.S., and the CPM has particular expertise in out-of-hospital, home birth, or birthing center community birth settings. And I think this is really important because, as we know, many of the preventable deaths that we're experiencing are happening in hospital settings, right? 85% of pregnancies are considered to be healthy and low risk. And evidence-based research says that the safest place for somebody having a healthy, low-risk pregnancy to give birth is not in a hospital. So it would make sense that we would have midwives who are trained specifically in out-of-hospital community care, providing that type of care in a state like New York.
Okay, next slide. I just wanted to mention about this slide, and I think, Danielle, you're going to speak to it more clearly, but there's so much of an alphabet soup out there. Perhaps those of you that are watching the teach-in today might be familiar with some of these terms, but there's such a, a range of definitions. When we talk about midwives, we have CNMs, we have CMs, we have CPMs, we have LMs, we have DEMs. There's all of this language around midwifery designations. And so I think, Danielle, you were going to speak to this slide.
Yeah, hi. So yeah, I'm going to give you a little bit of an overview of the difference between the two pathways, and then also a little bit of the history of how we got to where we are right now with licensure in New York. So again, there's two main pathways to midwifery. There's the nurse midwifery pathway and then the professional midwifery pathway. In New York State, we actually have three pathways, only two of which are recognized. So I'm going to kind of go through all that. So the nurse midwifery pathway, as you would expect, is nursing based. So you go through nursing school, you graduate from nursing school, you go into a postgraduate program to learn midwifery. So the nursing training is really just general nursing, and then you learn midwifery separate from that. But that's the nurse midwifery pathway. The professional midwifery, the CPM pathway, is a direct entry pathway, meaning that you step directly into the training for midwifery. So these pathways are very varied. They all include some kind of didactic portion, meaning that you're going to learn the book work, but most of it, as we've all kind of mentioned, happens in the field. So most of it is in the apprenticeship. You learn a lot of your skills, you attend a lot of births, and you see a lot, and you learn the scope of normal, which is very big. So in New York State, let me pull up my notes here. So the certified professional midwifery pathway, this is where we're going to get into some of the history, was started by folks who really stepped into midwifery because they rejected the medical model, because they didn't want to go to the hospitals. They stayed home. They started catching their own babies. They started catching their friends' babies, their neighbors' babies. They learned midwifery from being at births. And so when they created the CPM route, the route to certification, the route to this national recognition, they wanted to make sure that the CPM pathway is as inclusive as possible, right? So they wanted to make sure that if you, like Tisha, only attended births, you never went to university, but you have attended 500 births via doula training and all of the other pieces of your training and history, that you could get this certification. They wanted people who stepped into a classroom, learned, kind of the foundational pieces, and then went into an apprenticeship from there to also be able to. They wanted to make sure that communities that access to training wasn't a barrier. So they wanted to make sure that, if you don't have access to a university because there isn't one there, because you don't have the financial means to do it, because culturally, that you can't leave your community to go to a training program, but you could still get to the certified professional midwife certification. So there's a lot of pathways to get to the exam, and then the exam gives you this national certification. In the 1990s, so let me back up a little bit. So in most states, there's two pathways to midwifery. There's the nurse midwifery pathway, and they're licensed separately. And then there's some kind of licensed midwife that's typically a direct entry pathway. So most of these states now are CPMs. You go into that state with a CPM, or you do your training there and you get the CPM and you can get licensed. Some states like Texas, you can get licensed through the CPM route, but they also have their own training systems. So you can go through the Texas training system. You can be licensed as a Texas licensed midwife, not having a CPM, but you're still a licensed midwife. So most states have the CNM, the certified nurse midwife, as a licensed midwife, as its own license. And then they have licensed midwives, which are some sort of direct entry midwife. In New York State in the 90s, when they were creating the licensure, New York wanted to try something new. So they recognized that the midwifery model is what brings all midwives together, right? Nurse midwives and certified professional midwives practice under the midwifery model, which Tisha is going to talk about later. And they wanted to separate it from obstetrics. So they wanted to create this one umbrella license that is the licensed midwife in New York State. At that time, the CPM was really new. The CNM, the nurse midwifery training program, was a 2-year nursing program and then a 9-month certificate program. So you come out of essentially 3-ish years of school But the scope of practice at that point really was the same. So nurse midwives attended women through the childbearing year. They did primary care of the newborn. And they also, and so in trying to create this one umbrella license, the organization that is the Nurse Midwifery Organization said, we also are going to create a direct entry pathway. We know this CPM is over here, but we're going to create this direct entry pathway that you don't have to go through nursing, but you can step into our certification program, graduate from that, sit for the exam, and then become a certified midwife. So New York State said, hey, that's great. It's just this one pathway. It leads to the same exam. That's who's going to be licensed in New York State. So New York State licenses certified nurse midwives and certified midwives, but not certified professional midwives. So since then, things have changed. The Nurse Midwifery Organization. So in that time also, though, CPMs were allowed to sit for the CNM exam. So they could submit their education to the New York State Education Board, the comparative education. They could say that the comparative ed said, yes, you have the qualified education to sit for the exam. They could sit for the nurse midwifery exam and become licensed midwives in New York State. Around 2010, the ACNM, the Nurse Midwifery Organization, closed that pathway in New York State. So the Nurse Midwifery Organization said, we are no longer going to accept any applicants for our exam that don't go through our pathway, that aren't a nurse midwife or a certified midwife. So we're not going to accept the CPM. Also, since the 90s, things have changed, things have grown, right? So nurse midwives, so nursing has now gone from that 2-year program with a 9-month certificate to a 4-year bachelor's degree to become an RN, and then a master's degree, which is the midwifery training part. The training for midwifery really is the same, right? It's still learning about birth. It's learning about the reproductive year and how to support women in that year. But it also is very hospital-based, both programs, CNM and CM. So you're learning how to manage labor in the hospital. You're learning how to manage labor with medications. You're learning how to move into the operating room and be the surgical assist as a CNM or a CM. And now it's a master's degree program. The CPM, on the other hand, has really grown exponentially in number, in strength, and in the strength of the program itself and the strength of the certification itself. We are, our training programs are accredited in the same way that nurse midwifery programs are accredited. Our exam is accredited in the same way that the nurse midwifery exam is accredited, but our scope of practice still really focuses on the reproductive year. It doesn't include primary care. It doesn't include surgical assistance. It doesn't include medical management. It's really still midwifery. And so that's where we are in New York State right now, is that we have this one pathway to licensure, which is the nurse midwifery, certified midwifery pathway, and the CPM. But in New York State, licensed midwives are nurse midwives and certified midwives only. Does that make sense?
Yes. Thank you so much, Danielle. Let's move to the next slide. Thank you, Samantha. Danielle did a very nice job in providing an overview of the different pathways, the care that we provide as licensed certified professional midwives. As certified professional midwives is preventative. It has a focus on education and support for the birthing family. We are autonomous healthcare providers, and we work collaboratively and in consultation with other providers in our community to make sure that we have the best outcomes possible. One of the things that I wanted to say in terms of just an interesting fun fact based on Danielle's comments is that since the CM credential has been developed in New York, 150 certified midwives have been credentialed and licensed There's only 4 states that recognize that CM credential, but compared to the certified professional midwife credential in that same time period, 4,700 certified professional midwives have been credentialed and certified in that same time period, which is really in the last 3 decades. So we really have such a growth of midwives available, and the passage of the CPM licensing bill in New York would increase our maternity care workforce exponentially, and again, really stand to address one of the primary crises in New York are maternity care deserts. We have 20 counties in the state. Now, there's only 60 or 62 counties across New York State. 1/3 of the state of New York, the Empire State, is lacking of all maternity care services. No hospitals, no clinics, no OBs, no midwives. There are 20 states in which there are absolutely zero maternity care options. And again, that is another area in which the licensing of CPMs would fill that gap, save those long travel distances that families have to now do, save lives and be able to serve families in their own community, and really would add to the workforce and close up some of those maternity care deserts, which are absolutely unconscionable, really, in a state like New York. Can we move to the next slide, please? We just kind of let folks look at this. We don't need to read each slide, but we do really embrace, as do all midwives, embrace this midwives model of care. And many of you who are on the teach-in today either have had access to that service or have provided that service. We provide individualized care. We really emphasize shared decision-making, informed choice. Continuity of care is probably one of the most important facets and aspects of what the midwives model of care can provide. Now, in large hospital settings with certified midwives or certified nurse midwives, they are typically in larger practices. So you might be in a practice of 4, 5, 6 or more midwives, and you work in shifts. You might work a 12-hour, you might work a 24-hour, but you do leave at a certain point, often in the midst of somebody's labor, and you are replaced by the next person coming on. The CPM model really does pride itself on providing that continuity of care. We are on call for particular families. We are there when they're in labor. We are there until their babies are born. We are there for several hours after. And then we provide a very comprehensive schedule of postpartum appointments. In the practice that I work in, I can't work as a licensed primary care provider in New York, but I work with other licensed midwives. One in particular, shout out to the Family Life Center in Albany and to my partner, Betsy Mercoliano. We provide postpartum visits of day 1, day 3, day 7, 2 weeks, 4 weeks, 6 weeks. We really provide this continuity, this comprehensive model. So we really embrace the midwives model of care and are very proud to do so. Next slide, please. This describes, sort of the certifying body. The certifying organization is the North American Registry of Midwives. We are a national accreditation, as is said. Let's go to the next slide. Stephanie, I think you'd like to talk about this beautiful map that we have in front of us.
Yeah, I think this is a great demonstration of just like how much of the US, right, is already recognizing this credential. And it's really unfortunate that New York has not joined that pursuit. And, one of the things that makes that really difficult has to do with how we are licensed in New York being so different from how midwives are usually recognized by the Department of Health versus here it's by the state, the education department. And so it's very different. And so even though there are 38 states and there's legislation pending in other states, we would love for New York to be ahead of the game. We would love for New York not to be the last state to add on CPMs and to really move forward, right, with nationally certifying our midwives. And as Tisha mentioned, right, we know that there have been attempts, right? Adding the CM route was an attempt, but it hasn't led to the increase in the workforce that we would really want to see and that we know is available if we had the CPM route available to us. Just imagine again, if there's 4,700 new midwives in these last 30 years that have been able to be licensed, and they could be working in New York, but they've had to leave to be able to practice somewhere else. Just think about what that does for our maternal health care system here.
Great. Thank you so much. Next slide, please, Samantha. I also wanted to mention, as we're moving along in the slides, you might notice that Nubia had to leave our group. She only had a certain period of time that she could be with us today. She had to go attend to one of her clients in postpartum care. So I did want to acknowledge that Nubia has left the platform. We do have very high educational requirements, as do all midwives. We are not saying that, sort of the requirements that certified nurse midwives or certified midwives have to earn are in any way, not up to par or anything at all like that. We're looking to expand. We're looking to expand access to midwifery care. We're looking to train community midwives to serve their community and to do so in a way that is safe, that is competent, and that includes these educational components: lab work, clinical experience, didactic experience, 750 topics related to the practice of midwifery, over 1,000 hours of clinical preceptorship, knowing all of the things that we need to know to serve families well in low-risk, healthy pregnancies where families choose to birth outside of the hospital or in a birthing center. And, one of the things that Mila was able to do yesterday at this incredible hearing that the state of New York held, a Senate hearing on maternal mortality and morbidity, Mila was able to talk very eloquently about how the need for more birthing centers is absolutely apparent and would result in such a very positive way of addressing some of the maternity care crises in New York. But having CPMs be licensed in New York would be able to serve in that capacity of the birthing center setting. So we are trained specifically in home setting and in birthing center setting. And so these are some of our educational requirements. Next slide, please. Theory, lab, clinical learning, a lot of book learning, a lot of collaborative care with other midwives and care providers in the community, lots of didactic information, a huge national test that we need to take and pass to prove the didactic information, and incredible large, obligations with regard to demonstrating clinical care and competence. That is the background and the foundation of our training. Next slide, please.
Yeah, so as Tisha's mentioned, our education is really competency-based, preceptor monitored, hands-on experience. We are trained in the field to work in the field. We have to, our preceptors have to sign off on a binder of skills that we have to, not just one, but, 10, 20 times that we have to show that we've done this, and that we've done this to the point that we are skilled at it, that we can do it on our own and independently. And another component that's really important in our training that, again, I think Tisha, you touched on, is that continuity of care is actually part of our requirements. So in the hospital-based, university-trained CNM route, you have to get those numbers, but you can walk into a room with a woman who's laboring, be a participant in that birth, and never see that woman again. In ours, there are, I don't remember the number off the top of my head, but there are a certain number that you have to attend, 5 prenatal appointments with the same client. You have to be at their birth. You have to do their newborn exam of their baby and attend, 2 or 3 of their postpartum appointments. So you have to provide that continuity of care because that's such an important piece of the kind of care that we provide. And that's the kind of care that really makes such a huge difference when we're talking about maternal mortality and morbidity, right? Because if you know this woman's normal, right? I mean, if we have a lab result that falls into the normal range, but we know that that's actually high for this woman because she normally is here, that's significant. And we can recognize that because we've seen her for the whole of her pregnancy, right? And likewise, in postpartum care, when 50% of maternal deaths happen, if we know her birth story because we witnessed it, we are going to be on the alert. We know what to look for. We have talked to her about what signs and symptoms, and she feels comfortable calling us. If she's starting to have, mental health issues, she's going to be way more likely to call us and say, hey, this is going on and this feels uncomfortable and I don't know what to do about it, than the person she saw in labor who may not be the person she met prenatally.
Yes. Really, really important. That relationship. We say a lot to our clients, our work is relational. We get to know you. We get to really understand who you are, what you're looking for, how you work, how your relationships are within your family. And that serves to provide better birth outcomes. So much of what we do serves to provide better birth outcomes. May we have the next slide, please? Well, there's always, a blueprint. There's always a national, document or white paper that talks about, what we need to do as a nation to improve maternal health outcomes. And we really need to improve and increase, workforce diversity, having more culturally congruent maternity care. We need to have healthcare providers of color to help mitigate cultural barriers in the healthcare system. And midwifery is obviously a very important answer to those challenges that we face as a country. The next, and I think probably the final slide. No, I think we have maybe one more after this. Again, looking at, how we might be able to work within the state to satisfy some of the concerns that the state education department has with regard to what our background is and what our training is. If in fact it's not in a university classroom, then what do we, bring to the table? We are looking at, looking into undergraduate college level programs that we might be able to put into some of the SUNY and CUNY systems here in New York, looking at, this slide specifically talks about, addressing racism, institutional racism, and removing barriers to building the midwifery workforce. Obviously, that is what we are poised to do, ready to do, and would be honored to do. So let's move on to the final slide so we have time perhaps for some questions and answers as we kind of wrap up our presentation. Obviously, here we are meeting the needs of today and tomorrow by building the licensed midwifery workforce. And I think we really did speak quite comprehensively to how that would improve health outcomes and maternity care outcomes in the state of New York. We talk about some of the things that New York State is putting into place to really help with maternity care, one of which is the governor has a recent executive order providing time off of work without any jeopardy to your job to go to prenatal visits. I think it's 20 hours during a pregnancy that you are free to leave your job without any consequence to go to a prenatal visit. But how would you be able to access that wonderful service if there are no prenatal care providers in your community? We also talk about the very important aspect of increasing doulas and having Medicaid funding for doulas, and really finally bringing doulas into the light in terms of how we can help improve birth outcomes, advocacy, agency, satisfaction, breastfeeding rates. And again, having an increase opportunities for doula care is really important. But doulas are not clinical care providers. They are not healthcare providers, and we need to increase healthcare providers. And of course, CPMs are the way that we can do that. I'm going to pass it over to Mila. Looks like Mila's back on. We are, kind of moving along here. I don't know if now is the time for us to maybe answer some questions if people have. I don't know, Mila, you take it over.
Thank you so much for this lovely presentation. It's so helpful for many people to understand the history and understand where we're at right now in order for us to be the best advocates we can be as organizations and all of the spheres of influence around us, as individuals who are part of the community who desire this valuable type of care. So I want to give a nod to Nubia Earth Martin, Tisha Graham, Stephanie Angeles, Danielle Kitt. You guys have been doing the work, and we know how much the work is it's unfortunate that we have to carry this so strongly as we are, but meanwhile it's so encouraging that we are making the progress that seems really like we're turning a corner now. So we hope everyone stays engaged in this momentum, because we're going to need more of our community present, and so we'll be very clear about our asks when they're available. And so in regard to the Q&A, my suggestion is that people present to please note if you have any questions, and we're gonna drop them in the chat and address them in the shared Q&A after, so that we can get more of the helpful info out right now. And take a moment and ask yourself, what else do I want to know about this? And please drop it in the chat so we can be sure to focus on it. So for now, I'm going to prepare the lovely next group. Is that okay to enter? And thank you again so much. So next up is A Better Balance. And the wonderful folks who have been doing the work with A Better Balance include Jesse Workman, Mariah Engelberg. You guys are so committed to what's been happening. And I think one of the things I want to lift up right now is there are so many components to maternal and infant health, and we can't carry and know about them all. So one thing I love about this coalition is it gives us the opportunity to learn more about each other and what others are doing out here, and co-elevate the important work that we all know is important. The minute you get to understand more about what's happening, you're like, oh my gosh, I need to support this. And I hope everybody feels as inspired as I do when I learned about how a coalition of people also worked to get the medical leave reform bill going, and the ways that it impacts pregnant people and families and maternal health generally. Here now you'll learn about paid family leave, the new prenatal leave law. What a celebration. And I mean, obviously there's implementation behind that. And I'm sure you'll share more about it, but it's really important that we know that there's pregnancy accommodations, and the PWFA and PUMP Act. I think it's going to be really helpful for you to demystify, for me and everyone else here who wants to know more about this progress, and if you have any other needs. And I will just give a little shout to the fact that there is a more comprehensive teach-in that A Better Balance will do on March 19th, time TBD in the afternoon. But yeah, that this is just a teaser. So you'll have about 8-ish minutes with these folks, and then I'll also follow that. So take it away, you guys.
Thanks so much for that introduction, Mila. And I'm Jesse Workman. I'm a senior staff attorney at A Better Balance. I'm here with my colleague, Mariah Engelberg. Mariah, do you want to introduce yourself quickly, and then I'll jump in?
Yeah, hi everybody. Great to see you all. Thanks for having us. My name is Mariah Engelberg, and I am an organizer with A Better Balance, working on the temporary disability insurance reform bill, which we will hear a little bit more about. Thanks.
Thanks, Mariah. Yeah, I just wanted to echo something that Mila just said. I learned so much in that last segment, and I'm really thankful that we are a part of this coalition and then we're getting to hear the information, because I do think it's true. There's so many different components of perinatal health, and I had no idea about what I just learned, and I'm hoping that we're able to share some useful information here today about the rights of pregnant and postpartum workers in New York. And I will also say this work feels really close to my heart, this coalition specifically. I had a home birth in New York and am so grateful for the work of birth workers. I can't imagine having my child any other way. And I feel really lucky for that and thankful for the work that you all are doing. So A Better Balance is a national legal services organization and advocacy and legal services organization. We have a helpline where we hear from hundreds of workers across the country and hundreds of New Yorkers about what they're experiencing at work. And we focus on using the power of the law to advance justice for workers so they can care for themselves and their loved ones without jeopardizing their economic security. And we do focus a lot on the rights of pregnant and postpartum workers. And what we're going to talk about today is just the overview of all the different protections that workers have during pregnancy, during birth, and then in the postpartum period. And it is very confusing. It's taken both of us a really long time to learn what this landscape looks like. It's different to state. There are federal laws that protect workers. There are state laws. So we're going to, again, do a brief overview, and then we will do a deeper dive, like Mila said, in a few weeks in mid-March. You can do the next slide. And next slide. Oh, I also want to just make clear, I'm going to overview some of what these protections are in New York State. And a lot of this comes from federal law. And then Mariah is going to do a deeper dive into the medical leave campaign that we work on. And Push, who's president, is also working on that campaign. And we're going to talk a little bit about the history of it, what's happening right now, and ways that people can get involved. So what I have up here just goes over the different rights during and after pregnancy. So you have rights during pregnancy. It includes pregnancy accommodation, leave from work. And now that there's this prenatal leave law, that is also in the mix. And then during birth, and whether that ends up in a live birth or a loss, there's right to leave during that time. And then also when returning to work, we're going to cover just very briefly rights to pump at work. You can do the next slide. Okay, so under the federal Pregnant Workers Fairness Act, pregnant workers have a right to accommodations at work. And reasonable accommodations exist in other realms outside of pregnancy, but the federal Pregnant Workers Fairness Act covers pregnancy specifically. And most workers are entitled to these reasonable accommodations. There is a federal work law, but there's also New York State has a PWFA and New York City has a PWFA. So if you're in New York City, you're protected by multiple laws, but we're mostly overviewing the federal protection today, and that protects not all workers, but most workers are protected across the country. So examples of pregnancy accommodations include time off to attend prenatal or postnatal appointments, having light duty at work. It could be having a different uniform, having more breaks, having time to eat, working from home, modification of work schedule. There's a huge range of what counts as a pregnancy accommodation, and there's no prescribed list. It depends on what the worker's need is, and it's a negotiation between the worker and the employer, and employers have to provide pregnancy accommodations unless it constitutes an undue hardship. You can do the next slide. Thank you, Samantha. So in addition to having rights to accommodations, workers also can have leave from work, and leave can be possible as an accommodation under the PWFA, like I just said. But other ways of getting leave from work, there's the Family and Medical Leave Act, and that's a federal law. It provides job protected leave, but it's totally unpaid, which for obvious reasons is unworkable for a lot of people. However, it does exist, and it does include job protected leave, and it's there for people who are experiencing a serious health condition, and that includes pregnancy related conditions. There's also the new prenatal leave law, and this law, we applaud this law. It's really positive that we now have time specifically carved out for pregnancy related needs, and it includes time to attend fertility appointments as well as prenatal appointments. But I do think it's really important to understand here, it's only 20 hours, so that's less than 3 days. It doesn't substitute the need for medical leave during pregnancy, which may come up for a various number of reasons. It's really sick time. I think the best way to think about this is an additional sick bank on top of the sick leave that's already available to workers. So pregnant workers have an additional 20 hours. And again, it is a really important thing, but it doesn't substitute the need for medical leave. Then we have paid family leave, and paid family leave, New York's paid family leave program offers up to 12 weeks of job protected paid leave, and it includes up to 67% of a person's pay with a cap of around $1,200 a week. And then Mariah's going to get more into temporary disability insurance. But lastly, we have temporary disability insurance, and this is also available to people during pregnancy if there's any sort of serious health condition that is accompanying pregnancy, to be able to take time off. But unfortunately, New York's temporary disability insurance program, it's just what we call our medical leave program, it has a cap of $170 a week, and that's been stuck that way since 1989. And there's no job protection, and there's no continuity of health insurance. So this is really an unworkable leave program at this point for the vast majority of workers. And it means that for people who need leave during pregnancy, it is essentially unavailable. And again, the prenatal leave law only offers 20 hours. So, and it's 20 hours for appointments. So it really doesn't substitute the need for medical leave. At A Better Balance, we do feel like there's been some real confusion in the way that it's been communicated, as if it is adequately addressing the needs of pregnant and postpartum workers. And it just is not. We still need comprehensive medical leave reform. Next slide. Yeah, I just covered this. We can do, I will say about the prenatal leave law, it covers the vast majority of workers, including full-time, part-time, temporary workers. It's regardless of immigration status. It doesn't cover federal, state, and city workers or independent contractors. But unlike some of the other leave laws, including paid family leave and paid medical leave, it applies immediately for all employees. So as soon as you have a job, you're able to access that prenatal leave, which is really important. And we can get more into this when we do an in-depth deep dive on this, but in the paid family leave program, you have to be employed at your job for 6 months before being able to access paid family leave, which does not work very well for the way that pregnancy works for a lot of people. Next slide. Thank you. You can do the next slide. And next slide. I think that I may be done with my portion. I can answer questions now if. I want to cover pumping at work, and then I'm going to hand it over to Mariah to do medical leave. And then I don't see questions, so we can cover the questions at the end of our presentation. So workers also have the right to pump at work. And there's a federal pump act. And again, there's protections in New York state law and at the city level in New York City. And workers must be able to have the time and space to pump at work. The space needs to be private. It cannot be a bathroom. This is something that we will get into on a more detailed level at the next teach-in. But it's important to know that people do have the right to pump at work. All right, I'm going to hand it over to Mariah to talk about our TDI campaign.
Hi, everybody. Thank you so much for the time, and also really want to uplift. Thank you all for sharing all of this really important information. I've definitely been learning a lot, and unfortunately, one of the major themes I've learned is that New York is so far behind in so many different ways, and our paid medical leave program is no exception to how far behind we are. So just to give you a little bit of an overview, New York has something called temporary disability insurance. The temporary disability insurance law functions as our state's paid medical leave program. This offers people up to $170 a week in compensation, no job protection, no guarantee of health insurance, and no intermittent leave for any off-the-job illness or injury, and requires a form of medical documentation. So your doctors have to sign off that this is something that you need. In the context of pregnancy, a lot of people do end up taking temporary disability insurance, or TDI, for pregnancy. In fact, one of our colleagues shared with us, who works on our free legal clinic helpline. On the helpline, she hears from a lot of New Yorkers who are trying to take TDI to keep their pregnancies healthy, or to recover from childbirth. TDI can also be used to recover from pregnancy loss, including later term abortion, stillbirth, and neonatal loss, and anything else that really necessitates that people take time off of work to recover. That being said, this $170 a week with no job protection, no health insurance, and the inability to take it off in chunks is really not a workable program for many people in New York. Sometimes people sacrifice their health for a paycheck, and sometimes people are forced to take this leave because there's no other option. Another thing to kind of remember is that TDI can be taken for mental health, any kind of chronic illness, any surgery, or any other injury. It is something that it really functions as our paid medical leave program. And it is really one of the reasons why we've been stuck at this $170 a week, is that this bill hasn't been changed since 1989. And I'm not a lawyer, but I've learned that you should not be writing numbers into bill text because they don't index for inflation. So that is why we are stuck at this $170 a week. And it is nowhere near livable. It barely covers groceries for an individual, let alone a family. And we have been working as a coalition, and Push is here and has been working as well with us to try to make sure that our TDI matches the paid family leave program that we spoke about, which would end up providing workers with up to 67% of their paycheck, up to a cap, job protection, intermittent leave, and guarantee of health insurance. And we've been working with some of the incredible advocates at Push to pass A84, which is sponsored by Assemblymember Szilagyi, and S172, which is sponsored by Senator Ramos. And this bill is important for pregnant workers all across the state of New York, but it's important for really all of us who may need to take time off of work to care for ourselves at any point in our life. Paid leave is an economic justice issue, it's a health equity issue, it's a racial justice issue, and it's a gender justice issue. This is something that can touch all of our lives, and it impacts so many different communities across the state. It can be kind of challenging to think about, but all of us are susceptible to chronic illness or injury or needing a surgery. And we have a strong, diverse coalition that shows the breadth of New Yorkers for whom TDI is important. And that's really all of us here. And anybody in New York that you know, like at any point could need to take temporary disability insurance. And we've been working hard to try to get this across the finish line. The coalition has been trying to pass this piece of legislation for over 3 years. Last year, the bill passed in the Senate, was pulled off of the Assembly floor calendar at the last second. And we need to make sure that the lawmakers across the state know that we all care about paid leave and that this is something that we're all paying attention to, and that this is something that is important to all of us, and that this issue really can't be ignored any longer. So I would also just like to offer an invitation for anybody to reach out to me if you'd like to learn more about what you or your organization might be able to do to help push this important piece of legislation forward. If you've ever had to take TDI or didn't take TDI because you couldn't afford to, and if you feel comfortable doing so, please reach out to me or Jesse, just because we are going to need to continue to make noise about this. 2025 should be the last year that any working New Yorker has to sacrifice their health for a paycheck. And yeah, $170, definitely not a livable wage, particularly in an instance where you are in the middle of a health crisis and likely need as much money as possible as you're navigating that health crisis. So I will pass it over. I saw that there were a couple of questions, so thank you. And if anybody has any other ones.
Thank you so much. I hope that everyone is finding this as enlightening as I am, and definitely drop your questions in the chat. We're going to get to them. So thank you both. I'm going to continue with a 10-minute segment, maybe less, hopefully, on the Birthing Place Foundation's current efforts in collaboration with the New York State Birth Center Association. So I appreciate all that everyone's presence. I appreciate everyone's presence and all that Jesse and Mariah shared. And so, Samantha, I'll begin, and I won't need any slides. So I'm just going to talk from the heart, / couple pieces of paper. So first of all, the Birthing Place Foundation just became an organization within the past year. In terms of the Birthing Place and the work we've done since 2020, there's been a lot of grassroots efforts and ability to serve our community, educating thousands of families, and then starting the Womb Bus, a mobile wellness hub, and now opening recently Mariam Reproductive Health and Wellness Clinic, a collaborative team of perinatal professionals. And we're all in hopes to open a birth center. And so that's just a little background. One day I'll also share more about where we stand in those efforts as an individual organization. And for now, I just wanted to uplift some of the key focuses of the foundation this year, and also talk about yesterday and the maternal health hearing, and also about the coalition as a whole and how you can stay involved. So for now, I already mentioned Mariam Reproductive Health and Wellness Clinic that offers parent support and education and a range of health services. Familia Flourish, Breastfeeding and Beyond, which utilizes prenatal education and postpartum guidance so that people can come together for sharing infant feeding and breastfeeding experience, and also have doulas check on them, and also in partnership with Doulas en Español, able to check in on their mental health. And thankfully, my lovely chair at the Birthing Place Foundation is also a postpartum psychiatric specialist who really helped shape this and will hopefully create more comfort to all of the people who are interfacing with folks who might be experiencing mental health in the postpartum time, and that our doulas will continue to grow their skills in supporting lactation and mental health and appropriate referrals. So we're linking up with folks and organizations that are also supporting with mental health services, and we're glad about it. And I've mentioned Womb Bus. We also have Conscious Birth Collective Together mentorship program. The Together program has historically been a mentorship program since 2020 and has 5 cohorts of wonderful doulas who have been through and are now alum of our comprehensive 24-week program. This year, we are excited that we get to partner with Health Connect One and become also a training site. And so happy that the collaborators, the doula collectives who have been a part of this since the beginning, and some who have entered midway, that we're able to continue and expand our work and not only mentor doulas, but also train doula trainers so that we can continue to spread some of this valuable skill into our communities and increase language access and cultural competence for supporting the communities that we are within. And then we have a really great youth program. I could say so much about that, but I'm not going to right now. And I'm going to uplift right now this Mobilize Maternal Health, and just having the opportunity to bring together this lovely group of people and coalition building effort. I have no idea, honestly, what it is. Like, as we say coalition build, we're like, here's so much more that's possible. And I feel like all of the hopes that we envision are also I feel encouraged that it feels like so much more is possible. I do want to quickly mention with the yesterday's hearing, it was really great. Leah Webb and Samara Brooke, incredible, attentive, and so many other meetings that I was able to have. I just am inspired by the fact that it seems that they don't really know and understand the depth of the issues. And so I'm hoping that the conversation here and the ones that continue to happen will be informative to our legislators. And I just want to also encourage again to, drop something in the chat, say hello if you're already here. And also, if others catch the playback, to please say your affiliation, who you are. It'll be nice to know that people are engaging with this information. I also wanted to make mention on behalf of the New York State Birth Center Association, which I'm the president of. I wanted everyone to just, in the spirit of transparency, know that we are determining our legislative strategy. And basically, we want you to feel, as the community, aware and engaged and involved. And so I want you to know that our meeting is in March, and we have a couple ideas. Of course, there's promoting the bills that uplift access to birth centers, which includes CPM licensure, which we've talked about extensively today. We also would love to shift to the national accreditation requirement for licensure, which was the original bill intent that was passed in 2021. Obviously, we want pay parity for midwives who perform the same services in hospital settings. We love the idea of introducing bills that create access to state subsidies, which would permit us to have malpractice insurance at a lower rate, because that's the killer. It is not even okay. You see, I mean, these quotes are ridiculous. Anyway, we also want to find the most appropriate way to reintroduce the initial bill's intention, and or create a bill that helps reduce the burden of the certificate of need. And these are just all ideas, okay? So there's nothing firm yet, but when we meet as a team, we will be able to know and understand more about the direction that we are going. But I do want to say, on behalf of that, sorry, I just think it's really important to shout out to the people here and who've been really engaged along the process, that we thank you for being involved in the process and staying invested in the outcome. And when we, as the New York State Birth Center Association, need your action, we want to be able to reach out and push it across the finish line. Because right now, the budget negotiations regarding support for birth centers have not fully started in earnest. But when it really counts, we may need you to call your legislators and have this grassroots movement that we've been developing for years to help really push it. So I do appreciate your continued engagement. And so you guys have it here on the slide. Mobilize Maternal Health Coalition. Some of our initial coalition members and growing include the folks that you see here, ARIA Foundation, the Birthing Place New York State Birth Center Association, Haven Midwifery, Save a Rose, New York CPM, Soma, I think that one is, yes, and Push for Empowered Pregnancy, Carriage House Birth. We've been in touch with at least 4 other organizations that are doing great work, that are considering also being a part of this, or in touch. And we want you to also stay in touch. If you have an organization, reach out, join the coalition, bit.ly/connect MMHC will take you right to a form. And even if you don't have any need to join the coalition specifically as an organization, fill out the form, because we want to keep you posted with what's coming up in the future. And on that note, we do have things coming up, which include the future teach-in on the 19th and the lobby day. And we have chosen a day. It's March 26th. So we're going to need some more community organizing when that time comes around as well. All right, so Q&A. So all of us are here. We would love to address some of the questions that we saw in the chat. Raise your hand as one of the folks who, if you saw a question that pertained to you, and then we'll go in order. Anybody see a question that came up for their organization?
I think I saw something about where licensure stands, or what stands in the way for CPMs. And where we stand right now is that in New York State, in other states, medical licensing goes through the health department, but here in New York State, it goes through the state education, or through the higher education committee in the Senate and the Assembly. We have really great support in the legislature. We have, I believe, 36 Assembly members and 24 senators who are co-signers right now. But the problem is that, especially in the Senate, the Higher Education Committee will not move forward with the bill until we have the stamp of approval of the State Education Department. And SED is not they are an entity that we don't have access to. Like, we can't lobby them, we can't communicate with them. And so until they say, yes, we approve this education pathway for this credential, the Senate is unlikely to bring it up in committee and unlikely to move it forward. So that's really our big piece, is figuring out how to educate the educators about our education.
Yeah,
you want to say anything about that, Tisha?
Yeah, I was just going to add to that. We do have a very wide, bipartisan, broad support in both the Senate and the Assembly. And you're right, we have 24 senators and 36 Assembly people who very strongly support the bill. And we are continuing to increase those numbers in both houses. But we do have sort of this juggernaut of the state education department being the entity that controls licensure. And they want to, sort of they have established a mechanism for licensure for midwives, which is a bachelor's degree and a master's of science in midwifery. And we know that in many cases, licensure by itself can be a barrier to marginalized communities, to people of color, BIPOC communities, people who live in other parts of the state other than down in New York City, Brooklyn, or Stony Brook. There are only 2 programs that prepare midwives for state licensure at the moment, and one of them is really sort of struggling and fumbling. So we don't have access to the appropriate kind of education that we need, and we do have a barrier with state ed who wants all midwives to have a university-based training, and we're looking to get them to look at competency-based training, which is really a movement across the state. Competency-based training. So we're working on it. We are not going to give up. Of course, we're going to keep fighting until CPMs are licensed. We have lots of very good, strong support, memos of support, and letters of, support among many, many organizations. So we're going to keep at it, and we're going to keep everybody posted as we go.
I can speak to this question about self-employed workers. So unfortunately, under the federal FMLA, there's no coverage for contract workers or self-employed workers, which I will say in general, the landscape for self-employed workers is not great. And it impacts so many people because so many people freelance and do contract work. Under New York State paid family leave, if a person is self-employed, they can opt in. But again, this is one of those things where I think the vast majority of people, including myself before this job, have no idea that that's a possibility. And you have to affirmatively opt into the program and start paying towards paid family leave, just as people who are employed do. But you have to know to do that on your own. And I'm not sure what we're going to share out after this, but we can share more resources on that about how one would go about that if they want to. And if you do it within the first 26, this is also a ridiculous thing I'm going to share, but if you do it within the first 26 weeks of being employed, then you don't have to wait a 2-year waiting period. But if you wait, if you realize that this is a possibility and apply after the 26 weeks to opt in, then you have to wait a 2-year waiting period before getting access to paid family leave. And this is something, again, like that doesn't work for the vast majority of people's lives who need paid family leave, whether it's for pregnancy or for any other need. Usually there's no, that's not something that people are predicting 2 years in advance. And that's something that we at a Better Balance and then the larger coalition have been really working to change in the paid family leave law, so it is more accessible for self-employed workers.
Yeah, I'll ask my questions out loud. One, and this one we don't have to answer yet, I suppose, Jesse and Mariah, but I do. I heard of someone who said that they were a city employee, and they mentioned, and I'm not allowed to have the paid prenatal leave. And I was like, whoa. And I was just intrigued by that, and I don't know how true it is. And then my other question might be quick, if the CPMs know or have learned about the change in leadership in state ed, and if that feels encouraging, if you have any insight on that. Okay.
Yeah, so that is right. City and state workers are not covered. And it doesn't make a lot of sense. I think a lot of times there are carve-outs for city and state workers because they're covered by union contracts or other things, but city and state workers are not covered. So that is correct. And I can share with you, we have a pretty useful know your rights informational fact sheet on the prenatal leave law that I'll share with this group, and then hopefully we can share that out wider. Especially because it's new, it's a really new law. I think people don't have a good understanding of how it works, and it's really important.
So you guys see on the screen, we have a folder that has access to the links that we're referring to. So thank you. We'll put it in there at some point. So CPMs, did you have a response to what I mentioned earlier? Asked?
I don't know that we are aware of a change in leadership, to be honest. We are currently trying to connect with SED, but again, SED will respond to legislators. They will not respond to lobby groups. So we're trying to, go through our legislators to get to SED to set up a meeting to explain that actually our education does train us appropriately for the scope of practice that we're seeking.
And one of the things I'll mention quickly, because I know that we are at time, our organization is in the process of working with a lobbyist within the system who really is going to help us work with sort of these entities, state education, the state legislature, the Senate and such, and really knows his way around these systems and is going to provide some leadership and some guidance for us as we work within that, kind of rather challenging system. We will also probably be doing a GoFundMe and possibly some grant writing so that we can, sort of afford the support that we believe will help us get this bill passed and work within the entity of the state education department. So we'll keep you posted on it.
I'm sorry. I'm inspired, and I hope that other people who've been watching and have stayed this long continue to please stay in touch with us. As you know, this is not a platform where we have everyone's email address who entered, because it is a live type of platform, and we didn't ask for registration. We just had you come in. So our way of staying engaged with you is through that form. So please check it out. Also, that brings up a good point was raised about fundraising, and we're putting our heads together as a coalition as well about what some of our immediate and hoped for needs are in order to continue the work, especially with a lobby day coming up. And another one quick mention is that when you fill out the form, if you have any skill at all, I don't care if it's graphic design or, fundraising, or, just having a certain group of people that you are connected with, we would really love you to say anything. And one of the last questions were like, what else? Because we really want to know and understand who's a part of this movement. And definitely, I personally am really excited about our lobby day. I believe that the kind of conversations we're going to have with our legislators and, eventually the state, it's a lot of people I met at the event yesterday are really eager to make the connections, which will bring this and many things that I believe we're wanting to move forward. Okay, so forward motion. And thank you all once again for being present with us. Is there anything I missed before we say bye to everyone? All right. Bye. Take care. Thank you.